Good evening, everyone, and welcome to AAHL webinar today, and happy Asian American Pacific Islander Heritage Month. Today, we're really excited to have some amazing leaders with us to really go over their backgrounds and understand how we're building the next generation of Asian American Pacific Islander healthcare leaders. So really excited to have you guys here, really honored to have a great conversation to learn more about our leaders today.
Thank you, Andrew. Hi, everyone. My name is Jennifer Ho. I'm one of the co-founders for AAHL. We are so excited to announce that we currently have over 700 members on our LinkedIn page. So thank you so much for all your support. And we would like to present our new mission and values. For our mission of AAHL, we want to support the growth, representation, and transformation of AAPI professionals in the healthcare industry and to cultivate meaningful relationships by providing high impact opportunities. For our mission, we want to serve as the leading professional organization in producing and connecting AAPI leaders through professional, personal development, career advancement, and community engagement in healthcare management, policy, information, and technology.
Perfect. Thanks so much, Jen. This is Eddie Lai, and adding on to our awesome growth as we hit almost 1 year of being a community together, continuing to share experiences and encourage one another. I want to welcome Elisa Na, who is joining us from the Mayo Clinic as our head of career development.
Yeah, thanks so much, Eddie. Hi, everyone. As Eddie mentioned, my name is Elisa Na. I recently graduated from The Ohio State University with my MHA and currently in my first year as an administrative fellow here in Rochester, Minnesota with Mayo Clinic. I'm really happy and excited to be joining this really dynamic team and looking forward to continuing to connect with you all, and certainly happy to have any conversations offhand as far as it pertains to professional development. But thank you so much for attending.
And today's quote, we always like to start off our webinars with a quote. Today's quote is a Vietnamese proverb that goes over the, history of paying homage to the people that come before you. So it's when eating a fruit, think of the person who planted the tree. And this really is our inspiration for today's webinar, where we wanted to acknowledge those that planted the seed for us. All of us here on the panel are fellows. And we didn't really do this by ourselves. We did this with the help of those that paved the way for us. So wanted to start off with that piece of knowledge. So like we said, we're really privileged and excited to welcome our panelists today. We have leaders from across the US that lead prestigious academic programs in healthcare administration and public health. So I'll let them introduce themselves, but wanted to briefly introduce them here. So we have Melanie Sabado-Liwag, who's the director of the MPH program and assistant professor from California State University, Los Angeles. Paula Song, who's the chair and professor of health administration at the Virginia Commonwealth University. And Forrest Kim, who's the program director of the MBA program in healthcare and clinical associate professor at Baylor University. So Melanie, Paula, and Forrest, welcome, and I'd like to give you guys a chance to introduce yourselves.
Hi, I guess I'll start first. Thank you so much, Andrew, Edward, Jennifer, and Alyssa for inviting Forrest, Paula, and I to be here and kind of represent the huge field of health and healthcare. And it's such a wide spectrum, and Asians and Pacific Islanders are a majority of that. And a lot of people don't realize how invisible and unsung we are. So thank you so much for having and hosting us today. So as Andrew had mentioned, my name is Melanie Sabado-Liwag. I'm a health disparities researcher working community-based research, particularly with Asian Pacific Islander subgroups here in Los Angeles and throughout the nation. So from a lot of the perspectives of which I'll be talking about is, gearing up particular people towards public health and what that looks like in regards to marginalized and underserved populations, even those who are unfranchised as well as immigrants, many of which we are very well versed on, and how are the struggles that our family and our historical trauma has really enticed us towards that resiliency of where we are today. So thank you again for having me, and I'll pass it on to Paula.
Thanks, Melanie. I want to echo my gratitude for Al and organizing this organization and this event. I think it's really important and timely, and I'm delighted to be part of it. So my name is Paula Song, as you know, and I am at Virginia Commonwealth University in Richmond, Virginia. I recently joined the faculty and Department of Health Administration in the fall of last year. And I serve as the department chair of the Department of Health Administration. In our program, we offer Masters of Health Administration, both a full-time residential and an executive program, as well as a PhD program. We're situated in the College of Health Professions, and we are also starting an undergraduate program in health services. What else can I say? My areas of research are and teaching are related to the financial management of healthcare organizations. I teach primarily graduate level courses in financial and managerial accounting and corporate finance for healthcare. I also do research in this area, and most of my research now is focused primarily on payment reform, particularly around value-based payment models affecting underserved populations, and currently working on an evaluation of the Medicaid transformation in North Carolina. Turn it over to Forrest.
Great. Well, I want to also add my thanks and congratulations to the team that organized both this association and as well as this event. So my name is Forrest Kim. I'm currently the program director for the Robbins Healthcare MBA, which is at Baylor University. 2 years into this position here. Prior to that time, I was at the University of Incarnate Word, and then prior to that time, I was actually on active duty for 22 years in the U.S. Army. My last career was as the director of the Army Baylor Health and Business Administration program. And so my current research interests are really in looking at federal programs in healthcare, primarily looking at policies within the military healthcare sector, as well as looking at some disruptors to healthcare and how their disruption is really how it leads to improved outcomes. In terms of courses, I teach kind of the bookends of our course. I teach the capstone as well as the intro to healthcare system. And yeah, I'm a Southern California native, and just always, I think in this group of folks and talking about the proverb that we kind of led with, I am a second generation Korean American. And so my family immigrated, and my parents immigrated in the early 70s with my brother, who was 2 years old at the time, to Southern California, West Los Angeles. I ended up going to UCLA as my undergrad, but that's just a little bit about me, but very happy to be here today.
Awesome. Always good to hear about other Southern California natives. I'm a bit biased because I'm from Orange County. But really exciting to hear about the work that you're all doing. Kind of feel like going back to school. But since we all have you here today, we'd love to get your perspective and understand your inspiration and how you became involved in academia. So I'll open this question up to everyone. What inspired you to become involved in healthcare, specifically in the academic setting?
I'm happy to go first. So I have a Master's of Health Services Administration from the University of Michigan, like many of you, or MHA type of an equivalent. And I did an administrative fellowship and worked in the organization for a number of years afterwards. And I was ready to move on, but I wasn't really quite sure what I wanted to do. At the same time, one of my professors from Michigan, I did my fellowship at Ochsner in New Orleans, was in town for a conference. And so we met up for dinner, and he convinced me that I should really consider a PhD. He was pretty adamant about it. And I thought, given that I didn't have a lot of clarity about what I wanted my next step to be or where I wanted to go, I thought that in that time of my life, it was a good time to make that type of decision. Knowing that, a PhD could take quite a while. I didn't want to start too much later in life. And so, and I always felt that if for some reason it didn't work out in academia, that I could always fall back on my management degree and return to being a practitioner. And so that's how I got interested in healthcare. So I had the academic background from my MHA training from Michigan. And then, of course, that just sort of naturally carried on when I returned to Michigan to complete my PhD. I had no idea what I was getting into, but it all worked out at the end of the day.
It looks like it all worked out.
Thank you so much, Paula. Yeah, so it's kind of silly and funny. I actually tell this a lot to my students. So like many of us, I actually wanted to be a doctor. And but more so is very personal to me. So a lot of family members on my maternal side, and especially my mom, have succumbed to cancer. And so cancer is where actually I found myself as cancer prevention and control. And so I had gotten my undergrad in University of Washington, so go Huskies, whoever they are. And I really had fell in love with working at Fred Hutchinson Cancer Research Center there. And while I was working there, my mom had passed away. So I had to come back home and put my dreams of going to medical school on hold to really work and help finance my household. So I ended up working at another cancer center here in Southern California, which is City of Hope. And I had a really great mentor there. She was a pediatrician who basically had said, why don't you figure out what you want to focus on before you go to medical school and go get your MPH. And I was like, what's an MPH? And so we were doing population work at City of Hope. I was doing a lot of cancer survivorship with patients. And really understanding sequelae and whether or not they were really experiencing specific type of sequelae due to bloodborne disease transplants. And so I ended up working and going to school full time, which many of you probably have experienced. And obviously it's not for the faint of heart, but we are overachievers by nature. And so I ended up going to a night program through my MPH while working at this cancer center. And I started to really decide, where do I want to pursue my life? And I really fell in love with interventions and behavioral work. And how do I change the system from within, from top to bottom? And so a lot of the work that I end up having to do for the past 15 years is all based on health equity and how to change all the transferability of that knowledge from more systemic and transitional bedside to community and bench to bedside and all those different types of layers that often is missed within the healthcare system for us to kind of make that more relatable to populations such as ourselves who are often less literate on advocating for those types of issues. So that's how I ended up at Claremont Graduate University, and I got my PhD there. And then it then led me to do more work at a national level, and I was at NIH for a couple of years, trying to understand disaggregation of data. And so that's kind of still the work that I do today. But that's how I ended up in academia. I came back home cross country, and sorry, but we're the West Coast, so that's the West Coast. Right, Forrest. So off to you.
Yeah, actually, I got my doctorate at University of Washington, so go Huskies. So, yeah, so for me, I think I have a pretty common story, and I share the story a lot, like Melanie, with my students, just because I think the path into healthcare administration is very circuitous. I think most of us who end up in healthcare administration didn't plan from the start to end up in healthcare administration. So for me, I was pre-med at UCLA. I wanted to go into healthcare. My mom was a nurse. And I really had kind of a desire to go into the service profession. And so I went to UCLA, spread myself too thin, like some of us have done during undergrad. And I actually applied to a number of medical schools, but I did not get in. And thankfully for me, I was in ROTC at the time. So I had an alternative career path ready to go as I got my degree, my bachelor's degree. And as I was transitioning into the military, I was planning on taking a hiatus for med school. But then since med school fell through, it was really kind of the next best alternative. And so I ended up serving as a medical service corps officer. I was working for large Army medical centers, and the Army is great, and the military is great, as several of you know, in terms of for their education benefits. And so while I was on active duty, they had a Master's in Health Administration program, the Army Baylor program. So I went through as a student, and while I was there, looked at kind of the ability to actually teach and have that as a viable profession moving forward. And so the seeds were planted at that time to pursue a doctorate. The Army as well had a program to get your doctorate. And so I went then to University of Washington after serving 2.5 years at Brooke Army Medical Center as an administrator. And then I got my degree and then came back to the Army Baylor program to teach. So again, very circuitous route, but I think it's probably pretty common for those of us that are in health administration.
Wow, such great, inspiring stories. And it warms my heart to hear your inspirations. And I really relate to Melanie and Forrest. My parents went to the University of Washington, and my original research in public health was on data disaggregation for Asian Americans. You raise a common theme of career paths, specific career paths in Asian American Pacific Islander families about attending medical school. What do you think we need to change in terms of the underlying mentality that we should all pursue medical school? Any thoughts there?
So I guess I can jump in on this one to kind of get us started. We've got a great colleague, Paula and I, Christy Lamack, who says that the cure for more people going into healthcare administration is to have a television show like ER, where the administrator is a good guy and not some jerk who's just focused on the bottom line. So I think for me, it really is in many ways about visibility of Asians, Asian American and Pacific Islanders in the profession. I think you all are in many ways trailblazers in the sense that there aren't a whole lot of us at the executive level that have decided to pursue this career path. But I think a lot of it is just about visibility and doing a better job of sharing to others, having conversations within our respective universities and through larger organizations like AAPHA, just to get the word out of the viability of the profession. I do believe that one of the challenges with Asian American and Pacific Islanders is that we operate from a pretty narrow box of career choices. Doctor, lawyer, there's kind of just a handful that we're kind of raised on. And I think the better that we can do in communicating about the profession and just being more visible and more active, I think is one way that we can actually tackle that challenge.
How about you, Melanie?
Yeah, I'm more than happy to share. I definitely share the sentiment with Forrest about that. So I'm Filipino, and it's kind of funny because all my family are nurses. My husband's a nurse. He's actually working right now, and he's actually a nursing administrator as well. So it's kind of funny in that sense that we're grown up to see these things, but it's also a lot of that historical aspect of this is stable. This is a good job. You're going to make good money. But we're also evolving in this world of like, what are you passionate about and where's your strengths in terms of your skill sets? So I think one of the things moving forward, my best advice are two things. One is we need to better communicate about the viability of jobs and the success of being in those leadership positions and what those actually mean in regards to the system, and how do we communicate that with our older parents or our aunties and uncles, or even the people who are younger than us, about what those look like. And even though you often see these administrators as maybe old and white normally, there are people who are actively searching for these positions and holding them, but they're just, again, like Forrest has said, not visible. The second thing is mentorship. I think one of the biggest things we have to find are people like yourselves to mentor other people to pipeline up. The reason for mentorship is to build confidence. Oftentimes people don't want to take these leadership positions because they feel they don't have the skill sets. They often don't feel like they have the communication skills, interpersonal skills, to speak that specific language. And I think it again goes to a lot of the issues of how white America normally sees Asian American and Pacific Islanders as this subordinate, quiet type of person, when in actuality, we come with a very strong, again, resilience that new leaders like yourselves need to build. And that has a lot to do with trying to, connect with people, with your professors, with people in the workforce, who can give you that type of, boost, that you're capable of developing these types of leadership skills and apply for them. So it's one thing to have the confidence, and it's one thing to apply yourself to compete for these competitive and very noteworthy positions.
Great, and that raises a really good point about how education and the academic community can really foster that confidence and help students overcome those challenges. Paula, from your experiences in academia, what are some of the common challenges you see that students from the AAPI community face?
It's interesting. I will admit that I've been in a number of different institutions as a student, as a doctoral student, as faculty in 3 different pretty big universities. And I would actually say, part of the challenge is that we've had very relatively few Asian American students in those cohorts in my career. Really, it's been maybe 1 or 2 in each cohort, which is really remarkable. And it goes back, I think, to the earlier question about, how to gain interest in the field in general. I think health administration is a somewhat obscure field. People, it doesn't rise to the top of people's minds when they think about career choices, and there's a lot of education that needs to go on in conversations. And you all can probably imagine conversations that you've had, not just with your parents, but with other friends when you tell them that you're going to, pursue your MHA or you're going to health administration, and really having to explain what that means. It requires more explanation than it does if you say, I'm going to be a physician or I'm going to be a lawyer. People get that pretty clearly. So there is that piece of it. So I think for students and in programs and in academia, at least within the health administration programs that I have been a part of, I think there is a lack of sort of representation and role modeling there, that all students need really, that kind of support to help enable their success. And alongside of that comes the mentorship, and other pieces like that. So I think that's one dimension of it. I think the other dimension of it is thinking about, Asians who are not, born in the States or not very assimilated in the US also face a whole host of other challenges with language, with culture, with job placement, those types of things. Those are, additional sort of challenges that API students can face.
Thank you for sharing that, Paula. And I think, geography might play a role in that. Forrest, you mentioned challenges earlier. You went to undergrad at UCLA, but now are leading, the program at Baylor, which is really different from UCLA. Can you comment a little bit on the challenges that you see Asian American Pacific Islander students face at your institution?
Sure. I mean, I think just to Paula's point, I think there is a real lack of representation within our cohorts, and it is kind of surprising to see that. I think health administration has evolved and it's definitely progressed, and more folks are learning about it. But as we've talked about at this point in time, it's almost like you have to have your elevator speech memorized to how you're going to answer that question. Because everyone you talk to, you can talk to grown adults and they don't know. You can talk to a 6-year-old, 75-year-old, and they still won't know what health administration is about, because their whole perception about medicine is about clinical providers. And so I think the lack of representation is definitely a challenge. I think geography does play into it. I think probably on the West Coast and the East Coast probably may have more, but as Paula said, she's been at 3 large universities that even that are geographically dispersed, and there are a whole lot of Asian American and Pacific Islanders that are included in those cohorts. So I think that's a big piece. I think the other piece that I wanted to hit on is a piece about assimilation and language in cultural differences. I think part of the challenges for many in the community is just that, because there is in some cases a language barrier, it is difficult. And part of the issue in terms of the profession is the professional development and understanding kind of executive culture and professionalism. And some of those aspects are so nuanced that I think in sometimes it's difficult if there are both cultural and language barriers. And so to kind of comments that were made earlier, I think the role of networking and the role of mentorship is really critical in this area, particularly those that have an interest, that show an interest in this field. And I think we need to start a lot earlier than even undergrad to start communicating about the profession, getting into high school and even and beyond that to really find innovative ways of talking about the profession early, and then developing those mentoring relationships so that people can be coached alongside of those competencies that are really essential for the profession.
And when taking into consideration culture, Paula and Melanie, you probably had exposure to different cultures as an AAPI community member. How have you used your personal experiences and leveraged them in your institutions to advance your visions, on increasing diversity and representation?
I guess I'll start first. So I'm not gonna lie, it's more difficult to be a woman and to be doing this in the field, more so because there's a lot of other expectations beyond that. There is that other cultural aspect that we don't talk about, is how are we perceived and how do we act professional? So it goes back to that aspect as well. And so, there is a number of different things that we have to play in regards to those aspects. There is a lot of advocacy that we try to have both at the undergrad level and at the grad level of, identifying students who could pursue higher education or go into leadership positions and then aspire, to apply for other universities and other programs outside of your county. I think that's something that we often have to face, and that goes back to that cultural aspect. Is increasing that diversity is extremely hard because, as you guys know, Asian Pacific Islanders, we're very cultivistic. We want to stay where families are, where things are familiar. And so I often tell my students, go away, experience things beyond what you normally experience. And if you find yourself back, it's because the universe has called you back. And so, there is that level of, again, building that understanding and getting that confidence to aspire that. But I think that what you had mentioned about how to increase diversity, I want to touch on what Forrest had mentioned is, ironically, I work with, the introductory courses of higher ed with my college, and we're trying to understand how students even declared a major when they were a senior applying for college. And, they end up having to join the orientation for that college, and they don't even know what biochemistry is, or, and so because it's expected of them when they're applying and their families are helping them to apply. And so I think it goes down to that aspect of, speaking to parents and speaking in churches or speaking in community spaces to really explore and entice people in regards to what professional aspects are there and what are the avenues to get there. And if you so then become a nurse, then fantastic. But there's also nursing administrators, and there are people who end up, being bedside and choose not to want to do it anymore. I have a lot of friends that end up doing that, but I think people don't know what they don't know, and we do have to increase the culture on many different levels from that perspective.
How about you, Paula?
Yeah, it's a really interesting question. When I think about that, potentially how my story may impact the institutions that I have worked in. In academia, Asians are not considered an underrepresented group. So, for what it's worth, it's not considered that in terms of the mechanisms for example, external funding or other types of criteria. And yet we are people of color, and we're not the majority of our colleagues that we work with, or our students. And I think, you know, earlier in my career, and I think still today, I think one of the ways in which I hope that, you know, maybe I've contributed is that I think that many students, and particularly students of color, have found it easy, or potentially in some cases, to connect with me as at least the other person of color or only faculty member of color in the departments. And you know, I've had students, you know, from all backgrounds kind of say that to me. You know, they're longing to connect with faculty who share similar experiences that look like them. And a lot of times I don't look like them, but I'm kind of the closest thing that they might have. And I think that's one way in which I think that I have participated in that. And then I think the other way too is helping to sort of bridge those conversations. I mean, certainly diversity, equity, inclusion has been, you know, on the top of everybody's radar, particularly in the last year and a half. But it's always been an issue, right? It just hasn't risen to the level of visibility and urgency as it has today. But there have always been steps along the way in which every institution and organization that I've been part of could be doing better, or has had to grapple with a particular situation and not knowing how to do that, and looking for some kind of insight. And I don't claim to be an expert or to speak for anybody or everybody on anything. But I do think that, you know, that colleagues have probably found some sort of safety in being able to have those kind of conversations and at least gain one person's perspective on some of those things, which helps the conversation. And really, you know, the ability to have conversations about some of these difficult issues that we're facing and situations that arise is half the battle, right? In terms of being able to make any progress towards that. So.
Wonderful. Thank you, Paula and Melanie, for sharing those candid comments. I'm sure there's probably at least one person in each classroom that feels more comfortable talking with you just because of who you are and your experiences. I wanted to ask this one last question before we open it up to questions from the chat. If you're wanting to type questions in the chat, I encourage everyone to do that so we can ask and make sure that you get your voice heard during today's webinar. We talked a little bit about, Melanie, the glass ceiling for women. And something for Asian Americans and Pacific Islanders that comes up is the bamboo ceiling. So this question is for Forrest and Paula. What are your thoughts about the bamboo ceiling, and how can we come to overcome the bamboo ceiling in healthcare administration?
Yeah, so I guess I can take a stab at the question. I think this is a difficult question. Honestly, it's one in terms of when we're talking about kind of race and ethnicity, it's something that I struggle with personally. One of the things that I'm a firm believer of is that kind of the issues around race and ethnicity are highly nuanced. I don't think it's very, very clear. I think there's a lot of grays in every shade in between black and white in terms of the issue, and just the presence of racial discrimination and such. Just to kind of share, as I was kind of preparing and thinking about tonight's presentation, I had a conversation with my wife and just kind of talking through. She's an Asian American as well. She's a Korean American. We grew up together, and even between my wife and I, we grew up in the same town. We met each other in second grade. We have very nuanced kind of perspectives. We're not the same person, if you will, in terms of our experience as an Asian American. I know a little bit of Korean. I can speak conversationally. I was stationed there for a year. My wife doesn't know as much Korean, and we had very different kind of upbringings in the sense of our parental perspective. So that being said, I think it's a very nuanced issue. One thing that I do believe is I do believe that there are times where there are barriers to career progression that relate to discrimination, and I think that's widely believed, and I think people that have been involved, and I'm sure there's plenty of folks even in the audience that have experienced it. But I think for Asian Americans and Pacific Islanders in particular, I think part of the other side of the equation is also a lack of networking. And because, you know, if you all of you know, and if you experienced to some degree, those certainly that are on the panel that have even created AAHL and set up this event, understand the importance of networking. And we all know, based on the literature, that networking is the #1 way of getting a job, and career progression is similar. And I think in some sense, Asian Americans really, I don't know if it's a cultural or natural sense, haven't necessarily developed, it's not necessarily baked into our culture to know how to network, to understand the importance of networking. Me personally, my perspective for the longest time was just keep your head down and work your behind off, and it'll pay off. And I think a lot of us in our Asian cultures tend to have that sense, and we don't really understand the power of networking and how it's so integral to professional development within the US and within Western culture. And so I would say that is kind of equally a part of the equation, or at least somehow a dominant kind of issue as it relates to, if you will, the bamboo ceiling. And so I just try to press that and impress that upon our students, and really have kind of a reframing. And I think part of the development of our young leaders is to really understand the power of networking, the importance, and then also how to understand how to do it effectively.
Yeah, I mean, I think Forrest really said it beautifully. I don't know that I have that much more to add, except I'll say that I'm not crazy about the term bamboo ceiling personally, because I think perhaps maybe what Forrest was alluding to too is that there are a lot of ceilings that face, I think, people of color and women, and it is complicated and nuanced, I think is a good way to say. I do think it's incredibly important, the things that us in academia and who are educators and training students in health administration in ways that we can support them, but also by helping them develop these sort of professional skills, how to network, how to build relationships, how to foster relationships, how to mentor, how to be a mentee, all of these things, how to be open-minded, how to leave home and explore and move across the country for a job and take a chance and sort of leave the comforts of your home and community and explore those options. I mean, to me, those are the ways in which we can slowly start to make those steps and see more people of color rise into those positions, which again then contributes to the role modeling, the profession, the understanding of the profession amongst communities, developing interest amongst younger students to learn more about the field and explore, so those are some of the steps that I think that we can take to help overcome that. But it's a tough climb, and I think many of us in different dimensions are facing different hills when we try to climb those hills.
Great, wonderful. Thank you for sharing that. It sounds like there are risks that people have to take in their careers, regardless of race and background, in order to grow and develop. Melanie, you mentioned leaving home and going someplace else. There's a question in the chat from one of our members that said, I recently read an article in HBR that a lot of Asian immigrants came here being educated from mainstream American education and corporate culture. So they took higher risk paths like being small business owners. And as a result, they want their children to take more sure paths like a doctor, lawyer, engineer. What are your thoughts on that traditional path? I'll let Melanie answer first.
Sure. I don't think that the traditional path is bad, right? I just don't think that if we're all going towards those things, how are we effectively being representative to, what is true to what everybody else does? So if we really are wanting to be of American culture and assimilate and acculturate the way that our families want us to, then we all don't need to be leaders in that role of doctor, lawyer, Indian chief, right? I think that this is what they know, again, because of the way that they've been they understand Western culture to be, is this epitome. But if you talk to doctors, lawyers, and engineers, they'll often tell you differently. But I think that also one of the things that we often have to think about is, are we also providing them a justification for those things other than just saying, just do what you're told. And of course, we want to be very good children and we want to be very good stewards of our family. But again, it comes down to that aspect of, how do we effectively communicate to our family members that, this is a respectable job. And as immigrants, I think one of the biggest things, again, is security. It's being financially stable, being happy, and they don't want to see you struggle. I think that's kind of just what we always want for our next of kin. And as long as you're trying to explain those things and kind of reiterating back to your family that, I am successful because of you, of all your struggles, that then becomes more of, closing that loop, because they don't want you to struggle. That's the whole purpose. They came here probably with 2 cents in their pockets, struggling as hard as they can to get, working multiple jobs, odd jobs, just so that, we can have, a comfortable lifestyle, or that's what we want to be perceived as model minorities in this culture. But I think one of the things is that, again, it goes back to that risk aspect that Paula was talking about is, how do we then break these ideas of invisibility about what is nuanced about Asian American and Pacific Islander culture that has now evolved to be more American than what they think it should be. And a lot of it starts with that education and educating about yourself and how do you share that with other people. So I think one of the things that we did here is we shared about something personal about ourselves. And I think, I apologize with the plane. I think one of the things that we often don't do and what we need to train our health administrators and health leaders to understand is you need to share a bit about yourself. And you need to explain that struggle to other people so that you can then make that connection. And I think the reason why I say that is because our families often don't talk about that immigrant struggle. They try to hide you away from that immigrant struggle until you're old enough to understand. And I think that's something that we probably have to talk more about, is that understanding of what that immigrant struggle means and how do we transcend that as now first, second, third generation here in the United States.
Good.
So when I read Chris's question, I mean, there are 2 issues that I see. One is the experience of being excluded by American education and corporate culture as an immigrant, as an Asian American. And then the second piece is about then what they want for their kids. And I can just share in my experience in my family, and I'm gonna guess probably similar to Forrest's, my parents grew up during the Korean War, right? And they both had different experiences independently, but they had a lot and then they lost everything in the war. And then, then they sort of climbed their way back up and they made their way to the US, for the purposes of education. And my parents pursued that path. My mom came here, having graduated from medical school in Korea, to do her residency here. My father came to pursue his master's in political science and then eventually his PhD. And they took that path. And so I think all that they wanted for their children is to have stability. They view that and view financial stability as a critically important piece of happiness. and I'm not discounting it, but I think their perception of what that is can be very different than what their children's perception may be, but parents always know best. So so there is that piece of, but I think the stability piece is, and security piece is such a critically important part of that narrative. For example, what is interesting is that in Korea, teachers are highly regarded, very respected profession, and not just professors, but, you know, elementary school teachers, high school teachers. But, you know, that didn't translate into the US for my parents, at least. They were not pushing me to go into that kind of profession. They were really more interested in their kids having a profession that offered them sort of financial stability, you know, above all else. So it's just, you know, it's that has been the experience of sort of my family and sort of the families that, you know, I grew up with, all 5 of them in Eastern North Carolina that were sort of like me. There you go to geography again. But yeah, so it is a common sort of challenge that younger generations, you know, have to grapple with their parents in ways that I did not see my American peers having to struggle with, and having those conversations and having that level of judgment from their parents about those kinds of decisions that they did. And you know, so my tactic was then I stopped telling my parents what I was doing and I just did it anyway. And then I just let them sit back and watch.
You're so right, Paula. Like I'm being honest, like they'll never understand. Even if you try and try again to keep telling them what you do, they still won't. Right?
One thing that I would add, though, is that I know that CAMI accredited programs are required to publish their starting salaries of their grads, and so I'm saying this kind of tongue in cheek, but it's one of those things. I mean, there's published data on how much our grads within the different professions make, and kind of going back to the stability line. I mean, if you can share with your family members kind of the growth projections of the career, and I think that might be just one way of getting to the issue. But.
And also the job placements, you know, another standard for the CAMI accreditation is having an 80% or above job placement rate. That is, so, you know, programs in health administration really strive to meet that criteria, you know, which is pretty high, you know, in terms of job placement. And I think there's a lot of demand, obviously, in healthcare. There are a whole bunch of arguments that we could lay out as to why this is a great field to go into. But your parents kind of have to see it, and they have to have their friend's kid who's doing it and doing it well, and you know, and then it becomes okay.
And Paula, you raised a good point about stability earlier on, and the critically important pieces of a career. I'd be remiss if I didn't ask this question, because I know this comes up in a lot of our webinars about administrative fellowships. That's usually seen as a critically important piece in one's career trajectory. You know, if you were to advise a student and they wanted a pathway that might differ from the administrative fellowship pathway, what are some other options you'd recommend for students that want to be in healthcare administration but might not be an administrative fellow?
Oh yeah, I mean, so I think administrative fellowships are great. I did one, you know, but I also think that it's not the only pathway to being a, you know, healthcare executive. There are lots of ways to go about it. So, you know, you can go directly into a hospital healthcare organization in a pretty solid, you know, management level job, analyst level job, you know, and bypass an administrative fellowship route. There are other careers outside of, you know, healthcare delivery per se, which can also, you know, I think be really interesting. And consulting is and different consultants, you know, so you've got sort of the big consulting firms, and then you have the healthcare boutique consulting firms. You have the internal consultants within a healthcare organization as well. You know, there are obviously, you know, space in the payer side for which, you know, grads can go into. And all of those pathways are, I think, important and not an endpoint, meaning that you can't return to be back in healthcare if you want to be back on the healthcare delivery side of things. I think those experiences, having experience with different facets of the healthcare system, are really important and really valuable, and really help with your marketability as well.
Got it. I see Melanie about to say something. Please do.
Definitely, to add to Paula, like diversify your portfolio, most definitely, and show the loyalty that you're going to be stick to a specific type of location or place for a specific amount of time. So often we see resumes and all these different CVs that come out, and you're jumping so much, but it's like, what did you really learn from there? What are the skill sets that you've gained? So I think one of the biggest things beyond going to administrative, a trainee route is like, again, going into a coordinator position, project management. A lot of these lead to those senior level executive positions. If you are more of a quantitative person, definitely we need analysts. That is where the money is right now. Everybody is going towards trying to find people who know how to use data softwares, and it's the name of the game right now. So if anybody's looking for training aspects, like they definitely need people who have those tactical skills, but they're also looking for a lot of the interpersonal skills. So even if you're going through those training sessions and you're looking about how to really amplify your portfolio, you definitely need to start building your network, like that Dr. Kim and Dr. Song have been talking about, but more so in that way of like, how do you utilize that network to practice those emotional intelligence to then push it forward into, these types of aspects of going into, project management or coordinator positions or even analyst positions. It's just investing that amount of time to then get to that executive level. It's going to take a few years, but I think that's the name of the game too.
Yeah, and speaking of training and learning, Forrest, I wanted to ask you if you have any, podcast recommendations, book recommendations, or any other types of resources that you think would be beneficial for our participants.
Yeah, thanks for that question, Andrew. I think we're living in an age right now that there's no shortage of resources. And so I think I could just kind of rattle off a very lengthy list. Interesting generational differences, right? We grew up where there was no such thing as the internet. So now it's pretty phenomenal, the kind of choices that are out there. I would say, particularly as I kind of thought about some options for leadership and representation, just some recent article that I was found was an article, HBR article, Harvard Business Review article called "Diversity Doesn't Stick Without Inclusion." I think that's a piece that I've included, and I'm happy to share that in the chat here in a minute. From a leadership perspective, I'm pretty sold on Good to Great and Jim Collins and his level 5 leadership, and some of the principles that are shared in that book. The other thing that I think is really helpful is to be, and a previous mentor shared this with me as well, is don't limit yourself just to kind of the business management literature, whether it's published or books. Broaden what you read. And so one thing that she shared with me, a mentor, was, she, as an adult, she was in her 50s at the time, very much read teen and children literature. So if, for example, when the whole Harry Potter series came out, or there was Susan Collins books, she read those, right? The things that kind of expanded your aperture into think about just life in new ways. For me, particularly, my kids are homeschooled, and it's funny, I shared with my students, a couple of stereotypes about Asians are, they like to learn, they like to read, and they're, good at math. And, we hear a lot of the stereotypes. I was neither. I was the kid that was running around on the block, just screaming, having fun with the neighbors. Very hard to sit still. And so I didn't do a lot of reading. I wouldn't read unless I was forced to read a book. But my kids are going through this homeschool curriculum now, and it's literature based. And so, they're going through all this literature and they're reading all these great books. And I'll tell you, 9 times out of 10, they'll finish a book and say, "Hey, Dad, this is great. Have you read it?" And 9 times out of 10, I'll say, "No, I have not read it." And so what I'm doing, though, is I'm so very much enjoying the opportunity then now to go back and to read those books. And so one of the areas that has been great lately, just as a kind of a desire to understand the African American experience more, there's a book called "Roll of Thunder, Hear My Cry" by Mildred Taylor, which is a great book, and you gain a different perspective. And so I would really encourage folks to kind of not only look at business and management, but kind of have a wide aperture in terms of what you read. And then the last thing I would note is I'm a big fan of NPR. I really love Guy Raz's podcast, How I Built This. Lots of great stories through the pandemic. He talked about, interviewed folks, and the emphasis of his podcast was on resilience. And so through his story, you learn about a lot of entrepreneurs and their story. And so that would be another one.
Wow, there's some great resources. How I Built This is one of my favorite podcasts. So I appreciate you sharing that. Forrest, Paula, Melanie, we want to really thank you for your time today. You shared some wonderful insights that I know will be really valuable to all of our members. I know we have about 3 minutes left. We want to be mindful of your time before we have Eddie, Alyssa, and Jen close out. But wanted to give you 30 seconds, since this is AAPI Heritage Month. What does AAPI Heritage Month mean to you, and are there any family traditions that are important to you?
I guess I'm happy to go first. I think whenever you have these designations of a month for some specific thing, it's a really just nice opportunity for us to bring some awareness and intentionality to the issues facing a particular group or heritage. And so I'm pleased that some of these, unfortunately, there have been a lot of unfortunate events, but I'm also pleased that it's finally getting the attention, sort of mainstream, that it has lately. Because I think, again, that's the starting point really to have meaningful conversations and potential action and next steps to address some of those things. Family traditions, we don't have any family traditions related to this month, so I don't know if that was the question, but I mean, our family traditions are basically eating. I don't know. Eating is kind of the thing we do. That's the thing we do best together. I now have a pretty large family between my sisters and my parents and all of our kids, so eating and making food and enjoying, my mom is a terrific cook, and we try not to burden her so much, but it's just so hard because it's just so good. So
I'll go. That's why I was quiet as well, because I was like, food. So the biggest tradition for me too is keep that sacred all the way until you have your own kids and make that a tradition. I think that's something that we within our culture just keeps us very grounded. And I think whenever it goes back to that proverb that we started with, so thank you so much, is like, that food keeps us grounded to our heritage and our roots and why we're here and how we got here and the struggles that our family has faced and the struggles we will continue to face as a community. And so by creating spaces like this, where we are able to chat and talk, and maybe we wish that this could be longer, where we can just hear from people that are like us and find that solidarity and camaraderie is something that we should often find. And Zoom makes this happen, so thank you, Zoom, as well as the pandemic, unfortunately, but we're finding ways around it. So as we start to open up, I highly encourage you guys to continue this moving forward beyond the pandemic and the restrictions of remote learning and remote connection, because it really is going to survive through larger visibility. And so I hope you guys increase fold on 700 more to your organization, and I definitely look forward to connecting to any of you and each of you in the near future. So yeah, maybe we would share a meal with each other one day. So I look forward to that.
Yeah, I'll just be very brief. Food, totally echo the food sentiment. And I would just say, as kind of a closing thought, is that even with this has been a very difficult year, I think, for in so many different ways, and particularly with the social unrest, but I remain very hopeful. I think, at least in my lifetime, this is unprecedented in terms of the amount of support. I mean, it's kind of, we've got two things going on at the same time. We've got a lot of unrest, but at the same token, there's just been this rising support desire to really not just have diversity, equity, inclusion be window dressing, but really take action. So I remain very hopeful. So I'm very appreciative of the work that you all have done, and Jennifer, Andrew, Eddie, and Alyssa on putting this together. So thank you.
Of course, thank you for joining us today. There's very encouraging and hopeful words. I know we're the last thing between people and dinner right now, so I'll pass it on to Eddie to close us out.
Super. Once again, thank everyone so much for your time on this evening, for everyone listening, and especially to our panelists. I definitely enjoyed it, and it's a great way for us to close out our series of events this month as we observe API Heritage Month. And, once again, echoing everything that our panelists said, thank you for sharing your information down there. I'm going to go ahead and share my screen just to close this out as we, once again, give a big kudos to our speakers and get ready for food. But, just want to close this out. Once again, thank you from all of us here on the leadership team. We are so very thankful for everyone who is listening, everyone who will watch this recording, everyone who we've spoken to and met through this place. I know that my life has been made better for meeting all of you guys and hearing all the wisdom here. We invite anyone who's watching this to join our LinkedIn page to continue to grow that from 700 exponentially, just like Melanie said. We'd love to continue to see the representation and make new friends along the way. Again, if you have any questions or any other thoughts additional to this, feel free to shoot an email to our email address right there. The link, I'll leave this page on as well. And then we do have a group me. So I'll leave this page on to let you guys scan through as we close out. And it looks like some of our panelists also left their contact emails and contact information in the panel. But once again, Andrew, also, of course, thank you so much for leading an amazing discussion and bringing up some of the questions that I'm sure a lot of us in the audience, as well as here, wanted to ask. And so, we look forward to seeing everyone else in the future, and have a great evening, everyone.